Hello, everybody. Glad you could make it into our webinar today with HIPAA-1. I am Chris Novak. I am the COO here at Mac Practice. We have partnered with a great company, HIPAA-1, for all of your concerns addressing HIPAA compliance. It's a great partner that we've been working with, and we have quite a few happy clients that are already working with HIPAA-1. And it's questions that come up frequently from our support team on our calls. So at this point, I want to go ahead and kick it over to Kirk, and he's going to be running our presentation today. Take it away, Kirk.
Awesome. Thank you so much, Chris. I really appreciate that. Glad that we could get this set up and we can speak with you guys today and your clients, and really have appreciated the partnership and being able to work with great companies and great clients and practices that you guys have there. So without further ado, I've been around healthcare for 15 plus years now, working with organizations of all sizes, working in the software, customer satisfaction world. And so been with HIPAA compliance now for over 4 years specifically with the HIPAA-1 and now Enterprise Health team. So just a little bit of background about us. So HIPAA-1 is our software solution for HIPAA compliance. Enterprise Health has a little bit broader scope, and then they acquired us last year. And so we're working together. It's been an awesome partnership to bring that much more expertise and strength to our organization, but still letting us focus on healthcare, HIPAA compliance, cybersecurity. So it's been a great partnership. We've got certified experts. That's one of our cores, the biggest chunk of our folks here. That's not me. They don't let the smart people out this time of year. We got to keep them locked up and working on folks, helping them get folks set up with their HIPAA compliance before the end of the year. But great background of team there for our assessors. Lots of different knowledge bases coming from the provider community, from consulting, from cybersecurity. So it's a great pool. And we've got awesome software. We've got services that make life easier when you guys have to meet requirements. And of course, the big key, been at this for a while as a combined organization, and we're still at 100% success rate in responding to and passing the OCR audits. OCR, Office for Civil Rights, for those of you that aren't familiar, those are the guys that do the enforcing and the auditing for Health and Human Services when it comes to HIPAA compliance. So as we get into this, I want to make sure that I'm tailoring this to you guys on the call as much as possible. So we're going to have a couple quick questions here. Sarah's going to launch these, but let us know who you are. You know, do you work in the administration? Are you part of an IT group? Are you clinical? Probably don't have too many specific data security HIPAA compliance folks, but if you are on the call, I'd like to know that. That'll just help us out. So just take a couple seconds here. Please let us know what your current role is, and that'll help me kind of tailor the message. We'll wrap that up. And what do we got? All right, good deal. So most of you are administrative, some clinical. That's perfect. Great split. Okay, love it. Now, a little bit deeper here. 2020, I know it feels like it's been forever ago, especially with all this, everything we're dealing with. But I do want to ask, for you guys on the call, who completed a HIPAA security risk assessment last year? So just let me know, yeah, you completed one, no, you haven't. And this helps tee up the conversation as we go through the rest of the presentation. So I'll give you just a couple more seconds here. All right, perfect. Okay, so about 2/3 have not completed one last year. Hopefully you guys have all completed them this year, but you know what, we'll help you out if you haven't. Okay, so we got only about 1/3 that have completed it last year. Perfect. Now, I want to address that smaller group that did complete the OCR, or excuse me, the HIPAA security risk assessment last year. If you were audited, tell me how confident you would be that you would pass the audit. And again, this is for those folks who did complete one in 2020. We'll just give you a couple seconds here. All right, we'll wrap that up. Awesome. Okay, about 50-50, that's perfect. Love it. Okay, so on this call today, we've got a lot of administrative folks, some clinical folks as well. Not too many of you completed the SRA, the HIPAA Security Risk Assessment last year. Those that did, though, we got a good percentage that feel they would pass. And we get lots of answers there. You know, if you're not confident, then it's usually about knowledge internally, or you did it with spreadsheets and you're not sure if you're tracking everything right. We hear lots of different reasons, but it is complicated. It's HIPAA, right? So let's talk a little bit about that. Overall, your responsibility with HIPAA. Security risk assessment. It's got to be done regularly. We're going to get into that today. That's what we help folks out with all the time. You've got to have a remediation plan because you have to, A, identify gaps, and then you got to do something with it. You got to have policies and procedures. Big key here, they have to be updated. And you got to train staff each and every year. New employees, yes, and we see most people do that, but you've also got to train everybody again each year. And document. This is so critical when it comes to HIPAA. You've got to document what you're doing. There was Richard Severino, who's the outgoing director of the audit group for HIPAA. He made a comment, it's been a couple of years ago now, but he said that if you're not documenting it, you might as well not be doing it. So I talk to folks all the time. I'm like, yeah, we're following all the HIPAA stuff. Okay, are you doing a risk assessment? Well, no, but we're following everything. And the challenge with that is, and this is why this requirement's here, if you're not documenting, most of those efforts become non-intentional, which means they don't survive when people leave staff or somebody, you know, is out of the office for months because something happened in their family, whatever it is. That intentionality comes with documentation, and that's why it's so critical. And of course, part of that documentation, you've got to keep track of the vendors, MacPractice being one of those, that is going to have access to your patient data, because after all, it is your patient data. So we're going to dig into these, give you guys a good feel for it. And again, if you have questions, feel free to type them in as we go through. We'll try and address them. We'll certainly have a question time at the end as well. And we'll get you as good of answers as we can. And if we need to, we'll get some expertise on it and get back to you. But feel free to type in questions at any point, and we'll address those as we go through. All right, so let's talk about some of these things that you've got to do. We'll start with the risk assessment. SRA is also how it's referred to very commonly. So when do you need to do it? Okay, we've talked about you got to do it regularly. HIPAA requires that. If there's a breach, that's usually an immediate trigger to perform one, even if you did one, you know, just a few months before. They're good. You're up on deck basically to get audited at that point. You want to have an updated one showing that due diligence. General hygiene for cybersecurity. Doing this on that annual basis keeps you going. Make sure that you're staying up to date with changes. Make sure that you're keeping staff up to date. Really important just for general cybersecurity. Then, of course, the big one we hear about a lot is MIPS MACRA. If you're going to participate in that program with CMS, you have to have this done in the calendar year that you're attesting for, which means if you're going to attest in March of next year, you've got to have this done by December 31st of this year. Not all the remediation, too. I want to make that clear. But you have to have the risk assessment completed. You have to have a plan in place to deal with anything that was found. And then you can do the correction into the next year. But the SRA does need to be done in this year. All right, barriers. We live in a world of too much stuff going on, right? And these do take some time. There's no doubt. You've got to practice to run. How do you do this efficiently? Do you have the resources you need? How do you track it? How do you report on it? All those things become barriers for folks to meet this requirement. And of course, then you got complexity. If you add a location or two, how do you manage that? Adding new staff, new systems, etc. It all does add some complexity, and we understand that. That's why we're here. That's what we want to help with. So there's lots of reasons why you can't get it done because you're too busy. You're helping patients. You're taking care of folks. But why is it still important to do this, besides just the fact that it is a requirement? The SRA, the Security Risk Assessment, is an absolutely foundational piece to you guys protecting the data of your patients. The big pieces here, it's going to identify where you need to work, what areas you're vulnerable to somebody coming in and getting a hold of that sensitive information. And beyond that, it creates this roadmap that allows you to plan in an organized way so it's not burdening you, so it's not overloading you, to go through and move through the steps that are discovered and get you going and get those gaps closed up, okay? So it is absolutely critical, even though for all those reasons I just listed in burdens and blocking you guys from getting it done, it's a pain, but you've got to get it done and it is critical. So the SRA, what is it? What do you have to do? Okay, and we'll dig into this a little deeper later, but in a general sense, you got to gather information, you got to compare it to what the requirements are. Where there's gaps, you got to figure out what you're going to do with them, how you're going to remediate those. Then you got to have a report on it. And of course, finally, big number 6 there, you've got to do something with that remediation plan. Absolutely critical. So you're not just, you know, it doesn't do you any good to leave the roadmap in the glove box when you're driving, you know, Disneyland with the family, right? You've got to have the map out and use it. And that's what number 6 is about. And that is absolutely key. We have seen folks who were doing risk assessments, but never did anything with it, never actually remediated, and they were not viewed kindly by the auditor. In that case, I think it was a state attorney general, because not only can the federal government get into the auditing and the fining, for that matter, state attorney generals are also authorized to review, audit, fine for HIPAA violations. So again, got to do something with the information. All right, so that's the SRA. A couple other things we talked about. You got to train folks. Training is critical. We talk about 2020 again, cyber attacks. Man, healthcare organizations just got hammered, and they're still getting hammered. And the crazy thing is, it's no longer just, you know, the tenants and the HCAs and the huge corporations. They're going after small practices. It doesn't take much, and they've realized a lot of times a smaller practice may not be doing what they need to be doing to keep things secure and making it difficult. So it's easier. And those records are so valuable, guys. The data that you have on your patients is so much more valuable than what my credit card company has on me. It's just insane. It allows the bad guys to do more damage. And as such, they pay more for medical records. And hence the reason you guys are targets. And it is your information. You are the steward of your patient's data. Whether you get that to take a payment, whether it's their medical record with their diagnosis, you know, date of birth, all that good information that you guys have, which you need to operate, to take care of them, you're the steward of that information. Okay? And unfortunately, employees definitely can be the biggest risk. Not intentionally, but it happens. And that's why training is so important. It really does reduce any likelihood of being scammed, getting beat by any of these guys that are trying to get the information. Now, with the training, a couple things. You've got to have the HIPAA data covered. All CEs, that's a covered entity. That's you guys that actually practice healthcare. You got to train the entire workforce on the policies and procedures and the EPHI protection. Now, within that, there is new employees, got to train them right away. Then in addition to that, each and every year, you got to train everybody, okay? Now, you're thinking training, do you have to stand up in front of them and you know, get the old whiteboard out? Nope, it doesn't have to be that complicated, right? Lots of different training programs out there. Obviously, we've got it as well, but if you've already got a training platform for something else and they can add this in, make your life simple and do it. If you don't, find one, okay? Keys, as you look for those programs. Does it cover HIPAA? Does it cover phishing? Does it cover, you know, not posting on social media, those kind of things with that data? Where possible, make it specific to the different roles in the organization. The provider doesn't necessarily need to have the same information that the person running the billing needs to have, okay? Big key, the third one there, completion requirements. What does that mean? It means, is there some way to test that they actually retain some knowledge? You can't just have them sit in a class for an hour and be done. They have to have some kind of a, and I hate to use the T word here, test. Okay, there's got to be something that says that they retain some information, and there has to be a minimum score. Okay, so that's required. Keep it short and sweet. Doesn't need to be, hours and hours. That's not critical. That just puts people to sleep. Make it short and sweet. Get the information you need. And then there has to be some certificates that are produced or some way to track that your staff has all completed it with that acceptable score on the, I got to find a better word than test, don't I? But test, for lack of a better word. Okay. So again, if you're not training annually, not just new employees, but not doing it annually, do it. Find a program that works for you and your practice. Get it in place, just ASAP. All right. So we got the SRA, we've got some training. What about other tools? Okay. One of the biggest ones that we see is that business associate agreement. Hopefully you guys are all familiar with BAs, business associate. The one you all deal with is MacPractice, obviously. They are a business associate because they don't produce the healthcare information, but they work with it, right? Other examples, if you have a third-party biller, that would be a business associate. If you have another software provider that you use to manage additional communications with your patients, business associate. Whoever that is that has access to your patient data that you're the steward of, you got to have an agreement in place that says they are following HIPAA and they are protecting your data. One of the things that we started doing about 2 years ago is that we recommend all our clients that they ask for proof of compliance from their business associates. There needs to be something beyond just them signing a piece of paper that says they're HIPAA compliant. Get a little more assurance. Something that says they're doing the SRA, copy of a pen test, which penetration test, sorry, for those that don't know. Something along those lines that they have that says, yep, I'm taking this seriously. I am protecting the data you're entrusting us with. Right? And then get the business associate agreement as well. This requires and really outlines how breaches are reported, because it's going to happen time to time, right? One way or the other. And then how that is organized, where the fault is, etc., how they're going to release and what they're going to release. Okay. Very critical, but you need to keep them managed. So if there's tools that can help you manage the business associates, it's key. We include our tool with anybody that subscribes. It's built into our platform, really automates pieces. Again, guys, HIPAA, there's all sorts of reasons you don't want to do it. Try and find ways to make it easier. This is just one of those, okay? Make it easier, get the information you need, track it, electronic signatures, all that, just makes it very simple to do, okay? And there are other tools, security tools that you can do. BitLocker is another one that I always like to mention. You've got to have a way, especially in this expanding remote workforce that we have where people are taking work home, laptops get stolen, laptops get lost. You got to have a way to wipe that and to lock it up. So there are tools that aren't brutal cost-wise, that are not super complicated. BitLocker, ways to maintain your firewalls, etc. Find those tools that make your life easier and protect the data that you're entrusted with. Okay? And again, we've got great assessors with cybersecurity backgrounds, happy to answer questions as you have them that are more specific if they come up. All right, so get tools. And then of course, one of the big ones when we're talking about HIPAA compliance is reviewing and updating policies and procedures. We talked a little bit earlier about documenting. You've got to document. You've got to be intentional with your HIPAA compliance. The policies and procedures are one of the biggest ways to do that. They really, when they're used properly, right, not just on a shelf collecting dust, but when they stay updated, when everybody knows at least where they are, and you're validating each year with your SRA that you're following them, it really aids in continuity of a HIPAA compliance program. Absolutely critical. Now, policies and procedures, I get asked this a lot. What's a policy? What's a procedure? Okay, so I do love to go through this. The policy is what you're going to do, right? That's the goal. The procedure is simply how you're going to accomplish that policy. So you do need both. If you're ever audited, they will look for both. Be on the same document, that's fine. But you need to have what the stated goal is and intention, and then you need to state how you're going to accomplish it. Absolutely critical to have both pieces. These policies and procedures, often called P&Ps, are foundational to your HIPAA compliance, right? When you go through that SRA, the security risk assessment, it's not only validating that you have policies and procedures in place, but it's also looking then to see if they're followed, right? Because unfortunately, we see that, right? These are the gotchas that we run into. And again, we've done thousands as a company of security risk assessments with all types of organizations. We see these gotchas, if you will, come up. And then the first one, like I just mentioned, create policies and procedures, get them ready. You've remediated the risk, yay, but then never follow through. That's a boo, right? That doesn't work. So make sure that not only are they up to date, but they're being followed. Again, that's part of that annual check, is to make sure that you're still following them. One of the funny things that we see as we're going through and looking is there are lots of policy and procedure templates that are available for HIPAA. You know, you go find them online, you can probably find some free ones here and there. If you go that route, do make sure they're up to date. They're not, you know, policy and procedure from 5 or 10 years ago, but they're out there. Likewise, obviously, we provide them to our clients. Other folks have done the same. Go buy a policy and procedure manual, etc. Sometimes they don't get updated, right? It's like the example I show over there. It says example policy on top of it, and it says policy number XXX instead of an actual number. If you have those, double check everybody. Go look at the file on the desk. Make sure it's got your practice name on it, that it has an effective date, that it is signed by somebody in the organization. You've got to update those, okay? Got to have effective dates, etc. And again, you do have to get them authorized by the appropriate person in the organization, okay? So again, we see those all the time. Please make sure, A, you have the policies and procedures, B, they're up to date, C, they're being followed, okay? So those are some of the big to-dos as you go through and manage your HIPAA compliance. Now I want to shift gears just a little bit and really drill in to the process on the SRA. And again, think of the SRA as getting that roadmap in place. We're going to walk through a lot of those things we just talked about, but in an organized and comprehensive manner to make sure that you're doing what you need to do, okay? So this is how we run folks through it with the software, the HIPAA One software that we've built. We have assessors that can run through this with you, but I want to walk through the steps so you get a real feel for what it takes to do it and where you can streamline, okay? Step one, you got to gather information. All right, this is where a lot of the initial work comes in. Less so on subsequent years, especially if you're using our platform, because it keeps it and builds from year to year. But first year, this is going to take a little bit of time. All right. Now, first thing to know, HIPAA covers HR, it covers network server, it covers facilities. A lot of people get surprised by that because they think it's just technical. And of course, it's administrative, right? That's that HR portion. That's the training. All that needs to be organized and reviewed. Now, depending on the practice structure, you can delegate those out to different folks. You can see Sierra's got a role, George has got a role. George has got a couple roles because he's extra smart, right? So you get that. You have different roles. Database systems, that's talking about Mac Practice, or there's another software that you use as well. You want to get the data for those. So the same person can do them all, or they can be delegated out, but either way, somebody has to own each area to gather information. And that's done really simply. The gray box on the right of that screenshot, that's the HIPAA regulation, the citation from the HIPAA text. If you guys wanted to, I could just leave it up here for a couple minutes. You guys can read it. Those that haven't fallen asleep yet listening to me, you'll be out in another, halfway through that paragraph, right? Most of us don't speak that. I don't, right? You start getting into the shalls and the does and the who's and the what's, and I'm out, right? My eyes are closed. But what we've done is try and make this very simple. So you see right under question 1 and 19 there, it simply says, does the organization have a policy and procedure, PMP, with a formal process where HR notifies IT staff of termination departures? I can understand that, and I'm not the smart guy, right? So that's what we've done. We've tried to make this really simple. And so as you're delegating this out and somebody in the organization is filling this out for you who is probably even less HIPAA knowledgeable than you are, they can say, yep, we've got that. Perfect. Then the little red box pops up because you got to prove it, right? You can't just say yes and move on. It's yes and then prove it. You upload that document right into the HIPAA One platform, okay? Now, what if you don't have it, okay? First thing, when you click no, is that yellow box pops up and says, do not fix it right now. Can't do that. Because if you start fixing every little gap that you have right now, the SRA doesn't get completed. And that is more important than having them all yes, is completing the SRA and having a plan. More important to the standpoint that if you were audited and you had the SRA completed but hadn't finished the remediation, you're okay. If you hadn't completed the SRA, even though there's only one gap left, that's a problem. And when I say that's a problem, that means there could be a fine attached. Corrective actions, publishing information that you're not compliant, right? That's not good. That's not the kind of press your practice wants, right? So don't fix it right now. We'll give you a template in this case because it's a policy and procedure. We'll get you a template later that you can use. You can download it now to take a look at it. But don't fix it now, okay? To that end, if you have an old policy that something needs to be updated, if you have some insights right now, when you're looking at it, put in notes. Add attachments, even if it's not compliant, because that's going to make life easier down the road. All right. There is a third option. It is not there on all the questions. Not reasonable and appropriate for our circumstances. I've had some clients that thought, well, none of this is reasonable, right? So they're clicking that every time. And while that's a nice idea, it does not work in practicality. Okay. So if you do click that, you've got to explain why. And because I don't want to is not a good enough reason why, right? Here we're looking for really, you don't have staff, or what's a good example? You don't have a location that has this data, etc. Okay, there has to be a good reason. In the notes field is where you document that. All right, and again, that's not even available in all the questions, but there are a few that give that as an option. All right, hopefully this is making sense, guys. But again, that's how you gather information. Very step-by-step, English translations, simple yes, no, the occasional not reasonable, okay? Get the data in step by step. Then we're gonna move on. Now we have to figure out where we're truly compliant, make sure that we've got these answered yes or no properly. For everything that's not compliant, we gotta plan what to do with it, all right? Now, really cool here, that second column under risk, it says high. This particular risk that Steve put in here is not compliant, and it is a high risk item, which means it's got a high likelihood that it could happen or be exploited, and it's a high amount of damage that can be done if it is exploited. That equates to a high risk. It's more complicated than that, but that's why we do it in the background, save you time so you don't have to worry about it. Each item that shows up as you do your data gathering and your review that is not compliant comes here on this list. The HIPAA One software assigns it a risk level, high, medium, or low. And then you come through here right where that arrow is pointing, you click that icon, and you start editing, okay? Everything you see here is pre-filled in, all right? We've got this information here. Some of this is, we'll just call it what it is. It's boring. The threat, the vulnerability, it's boring stuff, but it's critical for an auditor or somebody who are going to look at it later. So it's here. The action plan, that's what you're gonna do, all right? In this case, we're talking about assigning a role as a HIPAA security officer, which by the way is critical for your practice. Somebody does officially need to be the HIPAA security officer. Note, I didn't say somebody officially has to be a HIPAA expert, just has to get assigned an additional role because they've already got 10 hats at a practice, right? Somebody's getting the 11th hat, and that is a HIPAA security officer, which means they just need to know where to find answers. Don't need to know them all. Sorry for the sidetrack there. When you're doing the remediation planning, make sure it's assigned to somebody. It defaults to whoever answered the question initially, but you can change it. Some folks will have an IT resource in the community that they use. They can assign something to that person to work on because it's an IT issue, or just somebody in the organization is going to work on it. It's going to figure out how to solve it and get it done. Then you need a target date. High risk items, get them fixed first. Give yourself 4 to 6 weeks maybe. Now, if you complete this in November and December is a nightmare, okay, start in January, but between the first 6 weeks of next year, high risk items, get them taken care of, okay? Then you can work on mediums, then low risk items down the road. But the keys for this remediation plan, what are they gonna do? In that action plan, we're gonna default to something generic, right? You are welcome and encouraged to customize that. Get it individualized to your practice, to your specific needs. It's got to be assigned to somebody, and there has to be a target date. At that point, you can move on. Compensating controls, we can talk about that another time. It just means giving yourself credit for what you're doing right. And my assessors or whoever can help with that. And sometimes you won't fill anything out there, but sometimes you will. All right, so once we got that all done, and again, you'll notice it only shows the one risk here because it's step by step, one risk at a time. And I will point out too, we talked about notes, we talked about attachments in that data gathering step. The link in the upper right there, click here for question that spawned this risk. That brings back, if you click that, any attachments that you had and any notes that you made initially. Or if you're working with my team, any notes that my assessors made. So we've got all that continuing along here, and it'll be there in remediation as well. So you have that background, that context, without having to dig back into your memory banks because you've seen, 15 patients and done, sent out 45 bills since you answered the question last time, right? This makes it so you don't have to dig back. It's right there on the surface, that context. Okay. We've gathered information. We've assessed. We've planned remediation. Now we got to finalize. This is the quick step. It's a big one, but it's quick and easy because you've done all the other steps right and you've done them step by step. Get in there, quick final review, electronically sign it so it has an official date and timestamp. And now you're going to move in and you'll start seeing this dashboard. Okay, you can grab the report anytime you want from here. So you have it. It's also going to show progress. That letter grade, if you start out as a B, that's awesome. Don't tell my kids that. They got to start at an A. But for you guys, if you start at a B, it's great. If you start at an F, it's not great, but it's okay. Because as you work through the remediation, you'll see that grade climb. And so you'll be able to see the progress. And that's what those two charts are for, just to help you see where you're at in the process of getting through your remediation work, which again is critical. The action history. This is where you track progress. This is absolutely critical. Again, back to that documentation piece. You've got to get the information in here. So the way you do this, you see who it is, what you need to do. If you click on the risk number itself, that pops up that context again. So you have the notes, any old attachments you can grab, you can review. Again, you don't have to remember everything. You don't have to go look back through the files where you had it, where you found it the first time. It's all centralized now, especially if you find somebody or somebody comes into the practice or gets a new role that you want to assign this to down the road. You can do that. You can change the assignee and they're gonna have the context right there. So put in what you're doing, add that in. When you get it completely remediated, you click risk remediated and it pulls it off this list. Retaining the information though for next year's SRA, so you can import all this great work you're doing in the initial data gathering as well as the remediation. You'll import it in and you're going to start, halfway down the field next year. It's an awesome system. It really does improve efficiency year over year. Okay. Now, the final report, just so you have a good look at that, it is complete. It's going to make any auditor smile. Well, I don't know that auditors ever smile per se, but if they did, they would smile when they see this because it is complete. It's really organized. It's, again, taking something that's really mundane and doing it for you. in the background. You don't have to worry about it, but it makes it easy because, again, the happier we can keep an auditor, the better off they are, the less likely to dig in any deeper. As soon as they start saying, well, where's the methodology? How do I know what you did? If you don't have that, then they're more likely to ask more questions and start looking for a reason, because unfortunately, these audits are subjective. The auditor's disposition, as much as we'd all like to think it doesn't matter, it does. Plain and simple. Okay. So that's our system, keeps it nice and in check. Now, we talked about burdens, staff, time. You guys are all looking at this like, okay, this is probably something I can do, but when am I going to fit it in, right? How much time is it going to take? So if you had people to divvy it up, this is how much time is it going to take in that first data gathering for each role on average. Now, obviously that's not the full assessment, but this is generally speaking the most time intensive piece is the initial gathering of information for your security risk assessment. And you can see those are reasonable. And again, you can bounce in and out. If you're working with our assessors, it cuts down a little bit because you have a resource to help you figure stuff out real quick. And then you're going to have, again, a few hours on the planning, an hour or so for the review. All told, you can probably get this done really cleanly in about 10 or 12 hours. Not counting remediation. I don't mean to say that because there's no way for me to guesstimate on that. Depends on how much work you have to do. But to get through the risk assessment, we think 10 to 12 hours is really a good average. Some folks faster, some folks a little longer. And again, that's man hours. It's broken up between different individuals. It can be broken up in different times, a little bit here, a little bit there. The system makes it easy to come in and out. So you're not lost if you don't stick with it for 6 straight hours and melt your eyes. You don't have to do that. No eye melting required. Okay. So from our standpoint, how we work with folks directly, obviously you've seen the software, right, that we just walked through. Really helpful, really simplifies something that is complicated. But you can take it in a couple different flavors based on what fits you guys, fits your budget, your specific needs. And we're okay with whichever method you want to go with. But you can do it on your own with our software. You can see, even though you're on your own, we're going to do a kickoff call with you. You're going to have the software, the policies and procedures. You can email us in for questions anytime. There's self-help. The facilitated remote, this is really popular, and I'll say popular for first year, because a lot of times you haven't done this recently. Some people haven't done it at all, but let's just stick with recently. And you're not a HIPAA expert. So use my assessors. They're the experts. They'll go through and really say, you've got this policy and procedure, but it needs X, Y, Z. And they'll spell out what you need to do differently. Then you build all that in, you get that remediated. Now you've got a foundation. If you want to simplify, save some money in the budget, next year just do a self-assessment because you've got that foundation. Or, do facilitated assessment each year because you're growing, you're changing, etc. And then if you really have very little time, a validated assessment, we're going to take as much off your plate as we can. Obviously, it's more dollars, less time for you, right? The things that we generally look at to help, and you guys can get a hold of us anytime and we'll figure out, what you need, how you need it. We look at number of physical locations that you have, number of employees. Do you have EPHI systems outside of Mac practice? And then, what flavor makes the most sense for you? But if you just want to know, you want to talk through it, we're here, happy to talk through it and give you any information you want. Right? Now, with this, and again, I hope I'm not putting everybody to sleep, so I want to wrap things up pretty quick. But if you want us to get in touch with you, let us know. We'll open up this poll question here for a bit. And at the same time, I'm wrapping up. So while we leave this up, are there any questions? Was I super confusing? Hopefully I didn't put everybody to sleep. I'm going to stutter now. That's great. But if you have questions about the material here, a general HIPAA question, I'm happy to give you my best shot at them. And like I said, if I don't have an answer today, then I'll get an expert and we'll get some answers. Likewise, if you want to talk, you can schedule a call and we can go at it that way as well. Okay, well, we'll give you guys a couple more minutes here. If you do have questions, hopefully this was helpful. Hopefully you guys are enjoying fall wherever you're at. We're out in Intermountain West, out in Utah. We actually had snowstorms and schools closed, or I don't think they closed. I think they were opened late today already, which is pretty good for early October. I'm not going to lie, which we need out here is getting a lot of water. So we'll close that down. And then if you guys have any questions, feel free to reach out. I don't think we have any questions going through there. So with that, we'll wrap up, guys. I appreciate your time. Please reach out anytime. You guys have a great day.